UK. First of all, I'm so glad to see so many young faces who are applying for the allied health and getting a degree in that one, and that's what we are lacking. Secondly, before I start, I'd like to apologize that we are a bit delayed, but it is not my fault or Dr. Yusra's fault. Your chairman wants to have a meeting with us, and it is for your benefit. That's there. So, just going back, this is the hospital where I work, and basically I'm working in United Kingdom for the last 23 years now. And when your University of Lord contacted me that I need to give some, talk and lecture on one of the health session, I was just thinking which is the best way to move forward. So this is the topic which comes into my mind. If you can see that being a pediatric surgeon, I can't work without my allied health profession team, because both of them are so integrated between each other that I need their help to get the proper diagnosis, the proper way forward, and how to treat the patient. So remember one thing, if I go back 10 years back, the system was totally different. Nobody knows about the allied health profession, but now everything is changing. It is such a vibrant field, and I must say that you people are so lucky to be in that field. It is progressing so fast that going forward in future, the medical field depends upon your help, your input, and your advice for the physicians, surgeons, radiologists to move forward. So it's a new era which we are talking about, the era of the allied health professions and the medical field to work together. How will they help? Better diagnosis, better outcome, better patient care, and also to help the community. So, I did a little bit of research that what I'm going to talk about. Just to give you a fair bit of idea, I can talk about surgery and medicine all day long. And Professor Sharif knows about it, that in pediatric surgery we have got such a vast subjects and topics. So these are 6 things which has come across to my mind. And I'm going to talk briefly on those 6 subjects, topics, and they're all integrated with your life and professions. Let's talk about telemedicines. I know most of you might know telemedicine. Can I have a show of hands? Who knows about telemedicine? Okay, one show of hands. Anybody else knows telemedicine? Okay, that's good. Anyway, it's not good, but it's good that I've chosen that topic. Okay, now, telemedicine is the way forward. Okay, we need, and you people need to know what is a telemedicine. Okay. In short words, telemedicine is a health-related advice which you can give it through the telecommunication and through the electronic media. We, as a doctors, we don't know much about the telecommunication and telemedia. Here your biomedical stuff also comes into action. What is it? Telemedicine? The patient does not need to be in the hospital. You can give the advice, whether it's an allied health professional advice or whether it's a medical advice, surgical advice, at the comfort of the patient, at your comfort also. You do not need to be in the hospital or anywhere. The patients can be in the parking lot, at their home, sitting on the couch, in the garden, in the park, and it will help them to move forward, and you as a allied health professional will be more helpful to them. What is the primary goal of the telemedicine? What is the primary goal of all of you? Is to give something back to the community in a very positive way, without putting yourself in pressure. So telecommunication is one of the reasons. Now, why it's important for Pakistan? Because you'll see that most of the areas in Pakistan, most of the people in Pakistan, they live in rural areas in which there is no communication or anything. Here comes the telemedicines. with the help of you guys, because you will be the one who will be setting up all those systems for multiple people in the department to work together. So the first thing that you cover the rural areas, which help any of the specialists to come on the phone, talk to them. All you need is just an internet connection. I know a few of the rural areas doesn't have an internet connection, but it is progressing. So telecommunication is one of the most important fields which will help them. So advantages, as long as I told you, that you can easily access to the specialists, low cost. Internet, everyone uses internet. Everyone has got a package of data free and everything. So if I'm sitting anywhere in any part of the world, I can access to any patient, any allied health profession to give my advice and to give their advice. Secondly, if the patient is quite unwell, they don't need to come to the hospital to spread the infection or anything. That's I'm talking about the COVID-19. COVID-19 has changed telemedicine. When I was sitting in my clinic, we cannot cancel the appointments. We use telemedicine. That helps a lot. It means that we still treat the patients without delaying anything. Now the second thing I just left at that no need for child care. This is extremely important. I've seen so many ladies, sitting in the department and everything, and most of the ladies, when they get married, they have the children, their family commitments become the first priority. For telemedicine, you can do it at home. You do not need to be in a specific part or department to do it. So it helps in the both ways. The same way, if any of the patients needs to come and they don't have the capacity to get anyone to take care of the children, they can do it at their home or anywhere. So this is the most important thing. Now, I should have had that slide, but the first video communication, which is called telecommunication, it's not a new one. It happened in 1959. Nebraska. Anybody knows where this Nebraska is? Anyone can tell me? It is in Europe, America, Africa. It's in South Dakota in USA that the first telecommunication part happens. Okay. It has got three subparts. Tele-consultation, which can be you guys giving the consultation to me, or giving the consultation to the radiology department, giving the consultation to the patient. Second, telemonitoring. Now, telemonitoring is the most important part. And I think so that for telemonitoring, I depend upon you people, because you are the one who are doing the biomedics and everything. If you don't give me the advice that, look, I need to do the telecommunication like that, I can't do it. And then come the telementoring. Anybody can do the telementoring on the system. You, me, anyone. So this is the thing. And then there are different medias. Video, sharing of the imaging, streaming, anything can be done. Now, the second thing, which is revolutionizing the media and the world and everything, is the telesurgery. You must have heard about the robotic surgeries and everything. This is the way forward, that the telesurgery can be done with the help of you guys as allied health profession biomedics, helping us to do the surgery while I'm sitting in UK or while somebody is sitting in America or everything. So this is the way forward to that one. Now, if you can look at this slide, which I put it on, if you can look on the top left corner on your side, this is when the patient comes, it comes to the allied health profession who just did all the basic investigation, and then further rest goes to the doctor. If you look at the bottom slide, that is what telecommunication means. Everybody is sitting at their comfort, still doing the same thing. Okay. Obviously, if the child, or sorry, if the patient is really sick, they need to come to the hospital. But how many patients comes to the casualty as compared to the general population? In UK, it's about less than 5% who comes as an emergency case. So you can well imagine about 90-95%, we can do that thing over the thing. And if you can look at the top left corner, it is, we can do it for anywhere, everywhere, anytime, and for everyone.